Hi, I'm Simone Jordan. I'm the Facility Manager at Mondia Health Sunnyside in Port Elizabeth. If you or a loved one is struggling and looking for a path to healing, we are here to help. At Mondia Health, we are dedicated to creating a passionate and nurturing space where individuals facing mental health and addiction challenges can find hope, healing, and dignity. Our experienced and caring multidisciplinary team partners with each person to support the unique journey towards lasting recovery and emotional well-being. We provide a warm, supportive environment where professional mental health care, therapeutic guidance, and practical tools empowers individuals to move forward with confidence and resilience. In collaboration with Ishvani Unplugged, we are privileged to share inspiring stories of transformation from those who have embraced their path to recovery and healing. These narratives celebrate rediscovered strength, renewed purpose, and the enduring possibility of hope. We invite you to reach out, as we truly believe that you should not be on your journey alone. Please contact us at mondiahealth.co.za or 067 437 9326.
African Traditional Medicine Week is marked every year from the 26th to the 31st of August. It celebrates the rich history of traditional healing passed down through generations. This week reminds us of the important role healers play in our communities, while also encouraging safe use, research, and working hand in hand with modern healthcare. Most of all, it helps us protect and celebrate African culture and identity.
Welcome back to Ishvani Unplugged. This is the People Stories podcast where we celebrate the lives of incredible individuals. And today we are at the beautiful Mondia Sunnyside here in Port Elizabeth, located at 24 Bird Street Central. And I'm joined today by Dr. Ntombizanele Menze, or Dr. Menze.
Yes, Dr. Ntombizanele Menze.
Yes, welcome, Doctor. Thank you for being here with us today.
Thank you so much for the invite. I'm really excited about our talk this afternoon.
Yes, yeah. So you're a part of the team here at Mondia Sunnyside. But before we get into the specifics, tell us a bit about who you are. Who is Dr. Menze?
Dr. Ntombizanele Menze is born and bred in PE. There's an area called Fear Plus, so Maguli from the location. So we started there, and then we were moved to an area called Govan-Beki.
Yes.
That is close to Mission Vale campus. It's just across there. Then I studied at Arcadia Primary, Hillside High, and then I went to Stellenbosch University to study medicine. And along my journey, spiritual journey has always been there, because I've always showed the signs that I am gifted, or there's something different about me. But it came a bit prominent around university time, but very much prominent during my registrar program. So I've now learned to, embrace the two worlds together and be this Western trained doctor and a spiritual doctor as well. Yeah,
that's absolutely incredible. And not many of us actually get the opportunity to do that, because traditional medicine is a very traditional sort of route. It's a more of a black and white route, and spirituality is all about, it's a feeling. It's things that
Absolutely.
you can't touch, see, or feel.
Absolutely. Yeah. So most healers will rather prefer to be called spiritualists, because with spirituality we incorporate everything.
Yes.
Under that umbrella. Islamic is under that umbrella. Buddhism is under that umbrella. African spirituality is under that umbrella.
Yes.
A whole lot of things are under that umbrella.
Yes.
And if I decide to take a walk on the beach and that's how I connect, that is also under the umbrella, and that is okay, and it's accepted.
Yes.
Me taking a walk and connecting with the higher powers,
yes.
Without me subscribing to anything else, so that is also acceptable, and that is what spirituality is about. It is flexible, it is fluid, it's incorporative and inclusive.
Yes.
Yeah.
That's absolutely incredible. So you're a general practitioner with special interests in mental health, and you're also a certified spiritual healer. So how do you tie the two worlds together in your daily practice?
Very interesting question, and I think a lot of people are very interested because the way we train is completely different. So if you look at traditional healers and how they trained versus the Western training, it's completely different, because remember, the journey with spiritual healing is led by your ancestors, and it's going to be completely different to the Western. So it's very difficult to pinpoint regarding the training. But how I approach it is that I emphasize on understanding that we, as much as we're spiritual beings, right, but we're spiritual beings having a human experience, right? What does that mean? If for me, it means that I'm biological. So I've got chemicals in my body. I've got, I'm part of a lineage, genetics. So I've got organs, etc. I am part of a background, a childhood, so psychological. That is where that comes in. We cannot shy away from our childhood and our traumas and what happened in the past, right? And then we're also social beings, and often when I start my groups at Sunnyside, I say there's a lot happening around us. There's disasters, there's crimes, there's violence. It's just a yucky time. There's financial difficulties, there's family dynamics at work, there's work conflicts. We cannot detach from that. So we're part of a social life as well. So we cannot detach from that. And then we are also spiritual beings having a human experience. And in whichever way that one wants to articulate their dis-ease, we don't like saying diseases, their dis-ease, right? Whichever way that you want to articulate your dis-ease, whether it's spiritual, whether it's biological, whether it's demons, whether it's you having a calling, it is going to still manifest in this body.
Yes.
So meaning a holistic approach is going to be absolutely beautiful.
Yes.
An incorporate approach is going to be absolutely beautiful.
Yes.
Me understanding that my patient has articulated having maybe demons, and I cannot say I don't want to talk about that as a doctor, you know.
Yes.
I have to embrace that whichever way they articulate their illness,
Yes.
but also making them understand that we are biological beings as well. And
Yes.
maybe there's a role for the medication.
Yes.
And that's where the psychiatrists come in with the diagnosis. There's a role for the psychologist as well, for the past and the background.
Yes.
And there's a role sometimes, not all cases, for the social stuff as well. And then there's a role for your spiritual journey as well.
Wow.
Which is absolutely beautiful.
I absolutely love that, because you know, in everything that we do in life, we are not, it doesn't just tick one box. When something is wrong with us, there are several contributing factors. I mean, even in medical school, we learn about environmental factors and how they contribute towards an illness.
Absolutely.
You know, your environment and you know who you are when you grow up, how others interact with you, everything affects you.
Absolutely.
And it all manifests in completely different
I
ways.
sometimes make a joke and I say, let's say now your leg gets broken.
Yes.
Are you going to only pray about it, thinking that somebody has done something foul to your leg? You're not going to only pray about it.
Yes.
You also need to go and attend and go to the nearest emergency, because you might actually end up losing that leg, you know, or it won't heal the way it's supposed to heal.
Yes, yeah.
So, for instance, while you're also navigating and, you know, praying the evil spirits away as
Yes.
well, but while you are getting the holistic type of help.
Yeah.
Yeah.
So you're part of the dedicated team here at Mondia Sunnyside. So why did you choose to come and work here at Sunnyside?
I was not only drawn by the beautiful facility, I'm drawn by their program. So I've been around the block, not to tease or be mean to other places that I've been, but their program is absolutely beautiful. It's so comprehensive, it's so holistic. So in the wellness wheel of Sunnyside, they speak about spirituality, and they emphasize on how important that aspect is as well. So they're not only looking at you coming in with maybe certain ailments or diseases, but they're also looking holistically, how we can meet you holistic, how can we walk the journey with you holistically,
Yes.
and bringing not only healing but hope.
Right.
Yeah,
Yeah.
which is absolutely beautiful. And their team is absolutely dedicated as well. It's people that are passionate and quite knowledgeable
Yes.
about what they're doing, which is absolutely exciting.
Incredible.
So patients are in safe hands.
Yes.
And what I like about, you know, the spiritual aspect, I think it's, from the hospitals I've been, I think it's the first hospital that would ever accept and embrace spirituality as well.
Yes.
Yeah, which is absolutely something very positive, that Mondia Sunnyside, all the Mondias basically understand that we come from a diverse society, right?
Yes.
And then the patients that come in would be representatives of this diverse society.
Yes.
And we have to meet them where they are, you know.
Yes.
Yeah.
So I had the incredible honor of meeting one of the patients from this facility, Vulindlela Inyoni, and he was actually on the podcast recently.
Oh, wow.
And, you know, his journey was such an incredible journey because he's such a high-functioning being out there in society. There's a lot of little things that he dabbles with. And he speaks about how, you know, when we go through certain things, you know, we also touched on a friend of mine had passed away. And, you know, I work also in a medical facility. And how suddenly, overnight, it felt like the rug had been pulled from underneath my feet. Just one thing that triggers us, and how it's like a domino effect into everything else. And then suddenly you're upset about things that happened to you in childhood. And that person who robbed you when you were 16 years old.
Absolutely.
So, you know, we always need these tools to sort of help us.
Absolutely.
To not just let us survive, but thrive. He speaks about thriving. You know?
Absolutely.
Yes.
Absolutely.
Yeah.
So that is what the one thing I like about the program is so holistic.
Yes.
Because even if they go to the recovery program, I know that they're going to deal with things that they have been ignoring all this time.
Yes.
So healers will talk a lot about shadows and our wounds.
Yes.
The things that are there in the background that we have decided to just
push to the side.
You
Yes.
know, but the program brings those things up so
Yes.
that you can understand why you're reacting to certain things.
Yeah.
Why are you relating to certain people in a different way or in this manner?
Yes.
So that is what I love about the program. It's so wholesome.
Yes, yeah.
Absolutely, I love it.
So we've decided to sit down today because coming up next week is African Traditional Medicine Week. It runs from the 26th of August to the 31st of August. So tell us a bit about what does African Traditional Medicine Week mean to you?
So it's a very interesting question because everybody wants to know. I feel it's a time for us. I think let's talk about it. What does it mean for us right now, in this era, in this season, in this time? We are headed in a season where we embracing spirituality. So when I speak about spirituality, it's not only going to be about African spirituality, but it's inclusive of everything under that umbrella. So it's a time for us to embrace one another. I think we're in a season of learning about African spirituality or traditional medicine and understanding. Remember, the collaboration can never happen without us understanding it, you know.
Yes.
And I feel the Traditional Healer Medicine Week, it's about, you know, psychoeducating everybody what it is about. But not only psychoeducating, but also embracing it in a very dignified manner and understanding there's such a beautiful role in integrating traditional medicine into our health system. But the how and the when is the conversation that we are now busy starting to have. Just before I came in, I was actually invited to a very big conference that is going to be talking about integration, intergenerational generation, and how to incorporate that into our health system. So we headed in that era where we're embracing traditional medicine, and by embracing it, I'm sure even yourself, you want to embrace something that you understand a little bit better.
Definitely.
You know, because if you Google what is traditional medicine is about, you will hear all sorts of things about love potions. I always make a joke and say, if I could make a love potion, maybe I would have 20 boyfriends. But that's impossible. Yeah. But it's about healing. It's about aligning others, you know, with their divine purpose.
Yes.
And it's about using herbs that are not harmful.
Yes.
But more in the healing, you know, ways of doing healing instead of breaking people and destroying people. So that is what it's about. It's about us understanding, embracing, and starting to have conversation about collaboration by making everybody understand what is this about? What is traditional medicine about? Because people are hearing a lot of different stories about traditional healers and what they do. A missing child, body parts were missing. There's a healer that was involved.
And there's this misconception.
This misconception, this misconception prescription. So I think this, for us in this time, in this era,
Yes.
traditional medicine week for me would mean
Yes.
doing a lot of work in bridging that gap of knowledge.
That's awesome.
You know, for the generations to come, so that everybody is just comfortable and understand what this is about.
And just to touch on that, I grew up in an Indian home, and in the Indian culture too, we have a lot of Indian traditional medicine. I remember as a young child when I had measles, my grandmother rubbed me with a turmeric paste and syringa leaf that she would make a little paste with. She had a stone and she would grind it, and they would apply it to us. And even now when I get sick, I still make the turmeric milk and add the ginger and sieve it out and drink it, and it's sort of like a potion.
Oh wow.
And it's so important that we also integrate these things into our daily life.
Absolutely. But the psychoeducation is important, and understanding who we are, what we're about, and what we're not, and and how to also restore the dignity of it all, and also making sure that healers are also held accountable, for harmful things that happen out there, because we need to speak about this. It is out there that sometimes, unfortunately, people are not going to know who's practicing the right stuff and who's not. So this week is there for us to also awaken to our responsibilities as healers as well.
Yes.
To embrace that, but to also know that there's some responsibilities with the journey as well, and with the work we do as well.
So what has been one of your most memorable experiences with a patient, tying in both worlds, your spiritual medicine as well as your traditional medicine?
I don't have one, but I have a couple, where you see a client that comes through that has, let's say you come in for depression and anxiety, but I pick up, oh my words, this person is actually so beautifully gifted.
Yes.
So I have a couple of those stories that I come along on a daily basis, see them on a daily basis, where you come for this thing and then, oh my words, let's pause, I'm picking up something very interesting. But let's work through this together. Let's see where we end up with this. And
I think that the experience can be quite scary for the individual going through it, right? Because when you start seeing things and you start sharing that with those around you, they start thinking you're crazy. Or something is
it's not okay. Why is doctor saying that? What's happening?
But it's actually not the truth.
And also the very successful stories that come through, and you say, remember that day when you said this, it happened, this day when this happened,
What advice do you have to somebody going through mental health stress, or a difficulty with mental health? How would you encourage them to seek help?
So at this day, remember in the past there was not a lot of services. So I always speak in my group and say, so some of our forefathers and grandmothers had no choice but to be strong. But we are living in an era where there's services available everywhere. We are living in an era that we need to make it fashionable to go and seek help for our mental health difficulties, and understand we are not machines. We have feelings, we have emotions, we go through disappointments, and we go through really hard time.
We do.
So I always make an example to them. What if now my phone gets the battery gets flat, right? I'm not going to press the button and press the button and press the button. It's never going to go on. So until I put it in the charger and charge it and get the help that I need. So you coming here is not only you're getting the help that you need mentally, but you're also realigning with the best version of yourself. Not only for yourself, but for your children, for your work, for your friends, for your employees, etc. So it's quite important. We're in that era now where we need to normalize speaking about mental illness and embracing it as well.
And I love that, because it does have a ripple effect. Because if you see how children who grow up in homes with anger, how they are more likely to turn out as angry adults too. But if you grow up in a healthier home, it has a ripple effect where you do have a much healthier approach to life.
And the ones that come and seek help, they're actually the generational breakers. Because now we're going to normalize in this family how we navigate around mental health. So everybody's going to go and get the help that they need.
And it takes courage, and it's
absolutely,
it's bravery,
Absolutely.
So what's your vision for the future regarding mental health, and how do you think that Mondia Sunnyside is contributing to this vision?
Wow. You can repeat that for me?
What is your vision for the future of mental health care? And how do you see places like Mondia Sunnyside contributing to that vision?
So, yeah, that is a very good question about Mondia. They already, I think in the vision of, they're already doing what they can in terms of providing the mental health and the model that they're using that is so inclusive.
Yes.
And I think most of all now that is new is including the spiritual aspect of mental illness and how this is about so that is number one. But already I think Mondia is quite ahead of providing the best comprehensive mental health care.
Yes.
And I think we are doing some outreaches here and there, where we visit certain spaces, we do awareness, we visit schools as an outreach,
Yes.
in order to bring the services closer to the people that need it.
Yeah.
I think that is where we are at the moment,
Yes. Yeah. It's absolutely incredible to be part of an amazing organization like this.
Absolutely.
Yeah. Well, thanks for chatting to us today, Dr. Menze. It was absolutely incredible. You're an absolutely wonderful soul.
Thank you so much.
And you are doing amazing work.
Thank you.
There's not a lot of people like you. It's quite a niche that you found yourself in, but such an important journey that you're taking in this world.
It's also a very difficult one because remember, I have to constantly understand that I'm also a medical doctor in the background.
Yes.
So we need to understand, there's two worlds, and I'm not supposed to lead my patient, into believing that what I am passionate about, but we can just walk the journey
together,
and meet them halfway.
So you have to balance that duality.
Absolutely.
Yes,
so I can't know me and you sitting here now speak to the ancestors. We can't do that. So I need to meet you halfway and embrace you. But I'm not, as Dr. Menze, allowed to say, I don't want to talk about that. I don't want to discuss your dreams. I don't want to talk. I don't understand this. So I'm here to walk the journey and embrace you the way that you are.
And like it says, we meet you where you are.
Where you are.
Yes,
Absolutely.
Okay.
Because sometimes you'll find that there's patients that are spiritually gifted. So if we at Sunnyside don't understand that component, it will be quite a bit of a disaster because some of them would have episodes within the groups, like a spiritual trance. So if we say, no, we don't want to talk about that, we don't know that, we don't want to learn about that, it's a bit of a problem.
Absolutely.
So the first thing that we did at Sunnyside was to psycho-educate the staff about, African spirituality, how it presents, etc. Because let's say now we start using beads in a group.
Yes.
And then if you're not aware, some of them that are gifted might actually have an episode, a spiritual episode.
Wow.
So if the team doesn't understand it, it can be a bit of a problem.
Yes, because then it's sort of, even in the Indian faith, we keep going back to Indian faith as well. But it's so interesting having this conversation with you because, in our culture, we also have, cultural activities, and then a trance comes out, an Indian trance comes out. And it's quite shocking to those around who bear witness to it because they're like, what's going on? Is this person having a mental breakdown? Because we also pierce where we put we do little piercings. And it's only through the faith and while you're in the trance that you can pierce yourself. And some people do 200 to 300 piercings while in the trance state. And the trance only lasts for about an hour or so. And then they pin themselves and then they remove the pins. And growing up, that was normal to us because everybody else around us did it. But only when you go and experience other cultures and then you start showing them pictures or videos, they're like, oh my word, that's very scary. Is that normal for you guys? So
which is absolutely beautiful because we understood here at Sunnyside that we've got the diverse society.
Yes.
So we've got to have different kinds of patients. Some are gifted, some are born again Christians, and they articulate the illnesses the way that they want to. But while we're busy with the group, some might actually end up, and if the staff doesn't understand that, it's a bit of a problem. And that's what I love about Mondia. They are so inclusive and diverse, and they believe in diversity. And that is one of the highlights. And I think if in the country, I think one of the few hospitals that still accommodates that, because we even have a spiritual group that runs on the Tuesday.
Oh, wow.
Yeah, we have a spiritual group that runs on the Tuesday, and it's not about African spirituality, it's about spirituality as a whole.
Yes.
And there we're looking at what is the role of spirituality in your journey as a person.
Yes.
I changed it, because initially I would say in your journey with your mental health difficulties, but I've changed it and said in your journey as a person. Yeah, because I don't want to put a stigma also on that.
Yes.
And we speak about, how God, some will say God has given me hope.
Yes.
I'm here today because I believe God is there,
Yes.
Then I would say we haven't fallen apart. We could have completely, we would have fallen apart completely if this thing that we believe in was not there.
Yes.
So let's tap into that thing. As long as it's safe, as long as it's beautiful, and as long as it doesn't harm the next person.
It needs to be sacred to us.
Sacred to us. And some will say, my walks on the beach are so sacred. I love it.
Yes.
That is when I connect. And when things are too much in life, that is where I go to.
Yes.
And somebody else might say, my family is my space holders.
Yes.
They hold my space so beautifully.
Yes.
And when they discharge, you're actually so happy as a doctor, understanding they have something that they believe in.
Yes.
That is going to hold them and keep them calm and content.
Yes.
Like a protective factor that we look at in medical school. Yeah.
Yes, yeah.
So it's so beautiful. And the talk is not about me talking about my journey and traditional healing, but let's talk about spirituality openly, freely. What does it do to you?
Yes.
And what it is, what holds your space right now.
Yeah.
So it's absolutely beautiful.
Wow.
Sometimes very interesting things happen in the group, where sometimes somebody might have a trance.
Yes.
There's crying in the group, and we accept that when we all cry together, because that is a space of healing.
Yes.
And sometimes things like, what does society say about how we seek help?
Yes.
What does my job say about what mental illness is? There's stigma around there.
Yes.
Family, there's stigma around there as well.
Yes.
So some will say, half of my family says that I need to go and speak to the ancestors and slaughter a goat. And then half of the family would say, no, let's go to Sunnyside, go and seek help. So we're having those very interesting conversations and making people understand that you're an adult and you can navigate the journey the best way you know how.
Yes.
And sometimes we might have difference in opinions in how we navigate, but at the same time we need to respect one another. Even in our families as well, we need to accept, because you'll find somebody that's coming from a traditional family, but they don't believe in the traditional stuff and they want to come to Sunnyside or whichever hospital that they want to. The family needs to allow them to flourish or to seek help the way that they want to seek it. So it's a very interesting journey. It's a very interesting setup in the groups as well. We've had a lot of fun in the groups as well, embracing spirituality, but the message is the biological, psychological, social, and the spiritual, the wheel that we still speak about. And it's been lovely. Absolutely lovely.
Oh, wow. You are doing incredible things and keep on doing incredible things.
Yeah.
So thank you for chatting with us today. We really appreciate your time.
Thank you.
And keep on changing lives and inspiring those around you to do the same.
Thank you so much.
Thank you, guys. I hope that you find that these podcasts are inspirational and motivational. And like I always say, we all have a story. So what's your story? Bye, guys.
Thank you.
If you are currently struggling with depression, anxiety, burnout, or dealing with trauma, we are here to help. We can support you with inpatient treatment programs, group therapy, support group, counseling, return to work planning, and corporate care wellness. We believe that it's okay not to be okay. You can find us at 24 Bird Street Central, our landline 041 450 8206, and you can follow us on social media.